even the country. We've seen outbreaks in different parts of the world. And today with experts out, and before I go to the day, for those joining us for the first time, permit me to talk about GET for 1 minute. Then I introduce the first speaker. The day in West Africa. It was clear during Ebola that African countries lack the capacity to cope with such level of outbreak, and there was an urgent need to serve organizations to work with both government and non-governmental organizations to build their capacity to cope with emerging biosecurity threats. My organization, Global Emerging Pathogens Treatment Consortium, was one of the organizations that was set up. And for 10 years, we've been working with both government and governmental organizations on the continent. And one of the platforms we've been using in recent years is this webinar, this monthly webinar, Avian influenza. Before I go straight to our first speaker, the rules that govern the webinar today are simple. We have 3 speakers that will be speaking to us. Each of the speakers will be speaking for us. And after their presentation, we'll give 1 or 2 participants opportunity. Any question, please. You can go to the and access section. So without wasting much time, I'll go straight to the first speaker of the day. I read the bio and hand over the platform to the speaker to speak for about 20 minutes. Our first speaker of today is Dr. Clement Meseko. Dr. Clement is the head of Influenza Laboratory and Director of Infectious and Transboundary Animal Diseases at the National Veterinary Research Institute, DVM, and MSc or PhD degree in virology from Ahmadu University, Zaria, and University of Ibadan, respectively. About 25 years in the animal health industry, research institutions and universities in Nigeria and abroad. Dr. Meseko is a recipient of the RSM World Bank Fellowship, fellow of the Alexander von Humboldt Foundation in Germany, and Fulbright Scholar in USA with international networking in its contribution to infectious diseases, especially highly pathogenic avian influenza control. Thank you very much, Dr. Clement, for joining us. I hand over the floor to you.
Good morning. So today we'll be speaking under the theme of avian influenza in Africa, specifically the epidemiology, public health impacts, and economic challenges. Next slide. So these are the outline of the presentation. I will run through a background of avian influenza, the transmission, the epidemiology, the public health risk, and we'll mention some of the economic challenges and offer some recipe for control. Next slide. So to give us a little background on avian influenza, it is a zoonotic disease of birds caused by influenza A virus. The influenza A genotype belongs to the Orthomyxoviridae family of viruses, so it is a virus. And influenza A virus are divided into subtypes based on the hemagglutinin and neuraminidase glycoproteins. So in birds, we have 16HA and NA and 9. But these are in birds, including white birds and domestic birds. They will also have influenza in bats also that carries the 18th hemagglutinin and 11th NA. And more discoveries are in process to even find out that there may be more of such subtypes in nature that science may eventually reveal. The most important subtypes of influenza A virus in poultry are the H5, H7, and H9. Our discussion today will dwell more on H5, which accounts for over 90% of all cases of occurrence of highly pathogenic avian influenza in Africa. And with respect to host diversity, we have influenza affecting avian, called avian influenza, that is the subject of our discussion. We also have influenza in both has spillover from white birds to even bovine in the USA. And so far, it is only America has mostly reported cases of avian influenza in cattle. That's actually a big concern for other countries and are being watched out for. And of course, we have avian influenza also affecting humans. So that is how diverse the can be, which also makes it important for interspecies transmission and then its zoonotic transmissibility. And with respect to the pathogenicity of avian influenza, we have it occurring as avian influenza. As the name implies, the low pathogenic avian influenza means its pathogenicity, but it is this same virus that may mutate or reassort over time to a strain that is highly pathogenic. Next slide. What first? At the pathogenic avian influenza to a highly pathogenic avian influenza. So it just means that the low pathogenic avian influenza sometimes may be in its host, it may not manifest clinically. But when it is in the form of highly pathogenic avian influenza, it causes a lot of death in domestic poultry, especially chicken and turkeys, which are most susceptible. And sustained outbreaks of avian influenza H5N8. The X means it could be N1, N2, N5, N6. And this has evolved over the years since 1996 globally. And in Africa, we had a maiden outbreak in 2006, which has also continued to spread this year. And this has become a cause of economic and public health challenges, which is being enhanced by intra and interspecies transmission. And then because of the virological nature of the virus, segmented genes, there are always reassortments. And this leads to emergence of novel, sorry, the screen has disappeared. So it leads to emergence of novel strains. I won't have the screen back. So okay, I think we're here now. So, and this increases the different kind of novel strains that we, and re-emerging zoonosis, because every new strain that emerges is a zoonosis on its own. It's there the prior to 1997, avian to human. But since 1997, starting in Hong Kong, several cases of avian influenza are being transmitted to human and causing fatalities. So it becomes a public health threat. And besides being a public health, cases in poultry sometimes can attain a mortality of 100%. all the birds may be killed by highly pathogenic avian, and this causes a lot of economic stress. Next slide. So how is this virus introduced? I mentioned that will be pathogenic avian influenza. To the other. However, as far back as 19, this was detected in the world. And with this map, there are different routes, imaginary routes, which crossing the whole Earth's surface. These are paths that migratory birds takes to move across countries. And the areas that are colored in yellow patches means that birds to meet one another. So a bird that's infected from one continent meeting another bird in another continent has a chance of transmitting soil. And we have that in Africa. And interestingly, the spot appears to be in Nigeria. And if you take all the cases of highly pathogenic avian influenza in Africa together, there are certain countries that seems to have more cases. Nigeria is one of them. Egypt is another, and South Africa. And recently, other countries in West Africa like Ghana and Senegal are joining the box. And that is the status of highly pathogenic avian influenza. So there is a chance that these birds will be all of white birds. Next slide. Now, when we had the case in 2006, the index case in Nigeria, it was caused by a particular virus, a strain that was named H5N1 plate 2.2, and that happened in 2006 in a commercial farm. Subsequently, after that, there was continuous reintroduction, and then in 2015, there was a reintroduction into Nigeria. And then this happened to be in a backyard farm and a live bird market simultaneously. And there was another cyclic introduction again, which I call the third wave. This also happened in 2016. This happened in 2016. And then there was a fourth wave that was also caused by another strain, H5N8 and H5N6. Interestingly, the H5N6 was only detected, there was only a single detection of H5N6 in a live bird market. And the clade was 2344B. But this particular clade had been with us since 2021. I indicate 2023 here, but even in 2024, there has been a detection. And this has been the continuous situation that highly pathogenic avian influenza is always being reintroduced. And then even if efforts were made to control the infection, then there will be another reintroduction by migratory wild birds. And the reintroduction may be of a different strain. that has continued to be the epidemiological scenario and dynamic of highly pathogenic avian influenza in Nigeria, not only in Nigeria, in the rest of Africa. Next slide. And why these birds are being affected in their different locations across the country. Between 2006 and 2008, we were able to identify several clades, 2.2, and within the 2.2, you have 2.2.1, 2.2.2, multiplicity of strains, and they were spread all over the country, as you can see in the map that was created by Kong et al. In 2012. And the situation is not very different from the other map that was created by Money and Mistake, where between 2015 and 2018, we have a different clade that was reintroduced into the country, 2.3. And then it was also followed by a subtype H5N8. And the interesting thing about this map is that clusters of distributions, which seems to be consistent in Nigeria. There's the Lagos cluster in the southwest. There's the south-south cluster around Delta and Rivers. And then there's the little better or northwest central cluster around Plateau and Kano. And that seems to be the pattern. Next slide. And then more recently, in 2021 and 2024, as seems to be the current scenario, Dr. Taiwo may be able to express more of this distribution. So as it stands today, almost all the states in Nigeria has at least reported a case of highly pathogenic avian influenza between 2021 and 2023. And I said earlier, we had actually had cases even in 2024. Next slide. Distribution of highly pathogenic avian influenza is that about this time of the year, with the harmattan season when the temperature is cooler, we've recorded cases that could likely have started in December. Information, if we must plan control measures, those are some of the evidence-based data that we can now use to plan strategies for the control pathogenic influenza in Africa. Next slide. At least in transmission of highly pathogenic avian influenza for highly pathogenic avian influenza in apparently wild birds. And the interesting story is that this particular clade, and in the period where it was detected, there was no subsequent transmission in domestic poultry. But it shows the potential that if there was a contact between those wild birds, either through the birds' contact or through formites or through human activities like moving some of the exotic wild birds to live bird market, there could be a transmission. And that potential remains, that until we are able to organize a surveillance that monitors what happened in the wetlands in Nigeria where the migratory wild visit, there's a potential that the virus may still be transmitted to domestic poultry And then the public will be first flag. White bears. Another major contribution to the epidemiology of highly pathogenic avian influenza in Africa are the live bird markets. We have an unconventional way of keeping birds in the live bird markets in the kind of images you see on this picture. And these white birds are mixed with domestic poultry. So there's a mixing of species. In one of the pictures, you probably will be able to see chicken, guinea fowl, and dogs. And we assume that if a dog is infected, it is not all the time that it will show clinical signs. So you bring in a dog to the live bird market and it's mixing with a poultry, and the birds that are apparently healthy, mixing and incubating the virus, not mixing with a susceptible bird, and somebody somewhere is coming to buy the susceptible bird, and the chicken is taken to, and that seems a pattern of introduction and circulation of highly pathogenic avian influenza in Nigeria and the rest of Africa, from the migratory birds to live bird market. So the live bird market becomes a hotspot. So several strains of highly pathogenic avian influenza and also low pathogenic avian bird market. We've picked H5N2, we've picked H5N6, we've picked H5N8, and then the low pathogenic H9N2, all in the live bird market. So the live bird market now becomes a source of transmission of the virus to the rest of the livestock value chain. Next slide. Next slide. This shows how the birds, how the infection, highly pathogenic, within Africa also, you see a pattern, the country affect. The map of Nigeria shows the burden of highly pathogenic avian influenza, as you can see. And you trace that to the rest of Ghana, Benin. Those are where there have been several cases of highly pathogenic avian influenza. And then you go down south, you see the map of South Africa. South Africa reported a high burden of highly pathogenic. And if you go up, that pattern follows the Nile River. And what is that? Where put there highly pathogenic avian influenza. So the livestock value chain is also kind of provide the basis for the detection of the virus. So in countries where the livestock poultry production is low, of course, there will be no susceptible hosts, and then you find fewer cases. And within all these regions, we've been able to detect. And then the interesting study that our team did in 2016 is several cases of highly pathogenic avian influenza that had occurred in Africa. And we actually found a pattern. For the clay 2.2, we found that there was a pattern of movement of the virus from Asia, and then it comes right down to Africa, as you can see in the upper graph. It's that there seems to be a pattern those even birds, and if we title the row white bird, the introduction as some of the theory then was that into sub-Saharan Africa, it sinks. So it means it doesn't go anywhere. It kills the guy, the whole dies and the virus dies. About 20 we find that possession of 5 markets in Sokoto, the infected bird or was now moved back to the sequencing in Nigeria was of the panic avian influenza. So it then means that rather than the final destination in Africa, there are chances the virus is now back to Europe, pathogenic avian influenza. If Africa remains endemic for the infection, there's a chance that there will be a retransmission. To susceptibilities of the virus, it is also affecting Africa. Now, the better reporting in Europe and America, better surveillance system in Europe and America. So they are able to detect some of these viruses before it even circulates. And the bulk of their detections are actually in wild birds. But in Nigeria, usually our surveillance in wild bird is limited. So we don't even detect in wild birds in the countries of Africa until there's a transmission to domestic poultry. Assuming the number of ducks you have seen in Africa will have been higher than what we are seeing now, and because our biosecurity measure for this highly pathogenic avian influenza. As we agree, and if it continues to circulate in bird, there will be to human, which we have witnessed since 1,000 cases of human infection by highly pathogenic avian influenza has been recorded. And on average, it has caused 50% case fatality. So what it means is that if somebody is affected by highly pathogenic avian influenza, the person has a 50% chance of dying. And what we have also seen recently is a spillover transmission from wild birds to domestic poultry that is ongoing globally. And so as long as the wild birds are transmitting the virus to domestic poultry, and as long as humans have contact with domestic poultry or even direct contact with wild birds, there will be a transmission, direct transmission to human from either poultry in live bird markets, in commercial farms, or even from wild birds. And why this is also unique is that the virus has adapted so that it can create an interspecies transmission. So there can be a transmission from duck to chicken, from chicken to human. And what we have recently even witnessed in the US is a spillover transmission from wild birds to dairy cattle. And so the virus is being shared in large quantity in dairy meat. So it now becomes a food problem, an issue with the food safety with respect to the recently evolved highly pathogenic avian influenza that spill over from wild birds to dairy cattle. And the picture in both shows how much contact we have with either even at the slaughter slab. So the feathers, the danders, the blood, and there's less protections, very limited PPE or none at all. So the chances of being infected is high, and that becomes a public health risk. Next slide. So what are some of the experiences we've had in the past on influenza as a pandemic? And then with influenza being a potential pandemic virus, or that the next pandemic may be highly pathogenic avian influenza. It is not new. In 1918 to 1920, there was a pandemic that killed between 20 to 60 million people. And more recently, in 2009, there was another influenza pandemic that was transmitted from swine. And to witness global spread of H5N1 since 2006, at least in Africa. Now, let's debate what may be the characteristics of the next pandemic. It may likely be a virus, and this virus may have a zoonotic status, even if influenza is a virus. It is a zoonotic virus. It is an airborne virus, so it can be transmitted through the respiratory passages. And when there's an infection in immune-naive population, it's actually what triggers a pandemic, because a population that's immune may not be susceptible to a virus or a virus that is circulating in the environment. But when there's a new virus that the population is not immune to, then there's a tendency that the virus will find a susceptible host. And influenza serves that category. Why? Because we kept having mutations and reassortment that brings about novel viruses. So the virus that circulated 3-5 years ago that we are already immune to, or at least a vaccine has been developed for, may be different from the viral that will be totally naive. The population may be totally, and it is transmission by migratory birds transmission, by movement across the globe, even by movement of birds and livestock. It can create a global spread. But most 10 highly pathogenic avian influenza or influenza in general, it just mutate like many other RNA viruses, but it has added reassortments to its arsenal. That's what makes highly pathogenic avian influenza a potential virus for the next pandemic. So we can prevent this, or we can mitigate it at least through surveillance, early detection, reporting and response, investments in research and technology, investment in vaccine development, investment in human capital development, and the One Health approach. Next slide. Now, you can see in this picture where avian influenza has the capacity to
Hello, Dr. Clement, are you still with us? we've lost. He has made most of his presentation. If he comes back before the end of the webinar, we'll give him the opportunity to make the remaining presentation. We lost justice talked about the various strain, the low pathogenic avian influenza and the high pathogenic avian. He talked about the transmission, and he talked about migratory birds as enhancing transmission of avian influenza as they migrate from one continent to the other. They are carrying of these contacts come in contact with nets. It's easy for them to transmit this virus from migratory birds. And avian influenza is not just, like he said, it's not just found in birds. It's been able to mutate and we also find it in swine, in both, and that means you find it in animal, in humans and states. The country has reported at least one case of avian influenza, and he showed us a graph that shows that is the outbreak or increases in Nigeria around February and March. And talked about many other things about the spread within the continent that we've seen it in Nigeria, in Togo, in the Republic, in South Africa, and in Egypt. And he talked about the public health risk of avian influenza. Since 1997, we've had about 1,000 cases and has a 50% case fatality, which is scary and very serious. And because it has interspecies transmission, that means it can move from birds to bovine to swine and even to humans. It makes it a huge public risk, because presently we're seeing the outbreak not just in birds, but in bovine and mammals and other mammals, especially in North America. And he talked about history of pandemics and history of influenza pandemics, starting from the one we had between 1918 and 2030, or killed between 30 to 60 million people, and talked about the possibility of avian influenza having the characteristic of a summary of what Dr. Clement of his presentation. We thank Dr. Clement for that very wonderful presentation. And I want our audience to know that I'm going to share his presentation with you, this webinar. So in case it is not available to complete his presentation, we're going to share the PowerPoint with you. So without wasting time, let me go to our next speaker. And our next speaker is my very good friend, Dr. Kirk Douglas. But before I introduce him, I want to say a big thank you again to our participants, those that have joined us from different parts of the world. Please, can you go to let us know where you're joining us from? Go to the webinar chat platform and let us know where you're joining us from, whether you're joining us from Nigeria. Just type your name, like say Dr. Mobadoye from Nigeria, from Lagos, Nigeria, from Nairobi, Kenya, where you're joining from. Without wasting much time, I'm going to introduce our next speaker. Our next speaker, like I said, is my very good friend, Dr. Kirk Douglas. He's the Director of Center for Biosecurity Studies. The University of Professional Senior Scientists recognized both regional diseases, biosecurity, virology, and zoonosis. He has earned a microbiology master's in microbiology and a PhD in microbiology, in medical microbiology from the University of West Indies KV Barbados. And he holds a master's in business administration. There's summer student in the to run one. Then upon returning home to Barbados, he worked as a veterinary laboratory technician at Veterinary Service Laboratory, Ministry of Agri, Barbados in 2000, on to an international medical device in Barbados. Equal assurance microbiologist to senior microbiologist managing the microlaboratory and junior laboratory staff while developing methods and strategies for improving product quality and process yields. With over 16 years work experience in the medical device industry, he has successfully led several critical regulatory audits by international organizations, including the administration, the British Standard Institute, and the Korean Food and Drug Administration. His initiative and innovation were exemplified in his industry-leading work to reduce endotoxin contamination levels in the intraocular lens. His doctoral research led to several novel findings of viral hemorrhagic fever viruses present in Barbados and the Caribbean, including the dengue virus, the arenaviruses, and cowpox virus. He has authored multiple peer-reviewed scientific papers in the field of microbiology, virology, biosecurity, infectious disease, and zoonosis, which has received almost 100 citations. Dr. Kirk, we're very happy to have you on our platform today. You have the floor for about 20 minutes.
Hi, good morning, everyone, and good afternoon, good morning, wherever you may be on the continent of Africa and those joining us from all across the world. I want to thank also GET Consortium for inviting us to be a part of their wonderful webinar series, and season's greetings to all of you. Let me begin to share my screen. So what I am going to be speaking to you about today is the pandemic potential of avian influenza, and particularly Africa's vulnerability and the lessons that can be learned from regional outbreaks. Now, avian influenza is one of the biggest virus, and risk is a dynamic entity, and it requires constant improvement. And avian influenza just represents a rapidly evolving risk. And so our systems, the way we do things, have to change as the risk changes. And so I'll be taking you through the pandemic potential of avian influenza, Africa's unique vulnerabilities, 1 or 2 case studies because they've been covered before. I won't spend as much time on them. The cross-sector lessons learned, pandemic preparedness gaps in Africa, and opportunities for strengthening regional resilience, and in closing thoughts. So the pandemic threat, where does this pandemic threat comes from? Well, just recently, there was a study that was published that showed that the avian influenza, the current H5N1 2.3.4.4b strain, has evolved in such a way that it's actually 1 mutation away from actually being able to be easily transmissible between humans. This is a very, very, very important point because the avian influenza virus can change in 2 major ways, either through antigenic drift, which is the common where we have point mutations, or you can have antigenic shift, which comes with reassortment. The interesting thing is that what we're seeing with this H5N1 is multiple animal species being infected, including humans. But this is really related to the molecular biology, the cellular structures within animals. And just to give you an idea, if you see this graphic here in the middle, the alpha-2,6 sialic receptors are often used by certain subtypes of avian influenza, H1N1, and we know we had 2009 a pandemic across the globe with H1N1, swine flu as it's called. These infect both swine and humans quite readily, and also H3N2, which is a human influenza that circulates across the globe annually. But what has emerged over recent times is that the bovine or the cow actually has these alpha-2,6 receptors, primarily in their udders. And what you're finding is that this virus is now being found in milk, raw milk within the USA. And I wouldn't be surprised if it's also found in other parts of the globe. Now, you have alpha-2,6, you also have alpha-2,3. And alpha-2,3 is predominantly found in waterfowl, and they're the primordial reservoir of avian viruses. But they're also found in horses, chickens, even dogs, and also domestic dogs and cats. But also the cattle also have this interesting alpha-2,3. And why this is important is because now the vessel where you have to reassortment. And what is reassortment? Reassortment is where you have two different viruses, they infect the same host and they share genetic material. Now, avian influenza virus is a segmented virus in terms of its genome. It has 8 different segments, and these 8 can combine with these other 8 in a vast array of different combinations. And this can then lead to the rapid evolution and change of avian influenza or human influenza. So a human influenza virus may actually take on certain characteristics of that avian influenza virus that human populations have never experienced that infection before and cause rapid spread, but also high fatality as well that are circulating, then now increase the risk of pandemics in across the world, not only in Africa. And the relevance of this to high poverty, like most parts of the world. And also there's the informal trade, we've seen the live bird markets, and then the close human to animal contact that elevates the risk. This was shared before, but I just had it in my presentation. This shows you the pathways, the migratory pathways of migratory birds and the emergence of or the risk of avian influenza. And as you can see, as the flyways pass through continental Africa, you can see where those spots of the emerging risk and the increasing risk of avian influenza lies. But I don't want us to just focus on avian influenza, but we also have to start surveillance in other animal types as well, including bovines. So there's a number of different factors that go into Africa's vulnerability, named socioeconomic factors. You have density, which requires then food to feed the populations, and then there's an increased demand for protein. And we know we as humans have a very strong liking for the taste of chicken, and so poultry farms are grown, poultry are raised on farms in high density. There are weak health and veterinary systems in rural parts. There are high-risk environments, like I mentioned, the live bird trade, or live markets, and the small holder poultry farms. And then there's the lack of biosecurity in these areas. There's also the risk of biodiversity and wildlife, as we saw with migratory birds, migratory flyways, with the risk of spillover. And then this huge monster that we know as climate change, altering and changing the behaviors of these migratory birds and causing a change in migratory patterns and habitat. And this is from Barbados correlated quite well with the situation within Africa in terms of small holding, poultry farms. The biosecurity on the farms are sometimes not as strong as you would like. And as you can see here, you have poultry on the outside of the farm. You have wild birds that can interact with these poultry, and these are layers. And layers are different from broilers. They're raised to probably 4, maybe at most 5 weeks, but then they're slaughtered. Where like also the fact that of the actual pens where these poultry are raised, you have the entrance of wild birds, as you can see here. And then obviously if they're excreting, then this could infect or make contact with the birds and also the feed. And so you have a link from not only migratory birds, also resident wild bird vectors that they link from so the migratory birds will introduce the avian influenza strain, but that can then be did further by local resident bird species. And we see in Dr. Clement's presentation, he mentioned a lot of detail around these particular outbreaks on the continent of Africa, in Nigeria in the years 2006, 2015 to 2017, and 2021. Also Egypt from 2006 to present. There's high zoonotic potential, and there's a continuous risk of human infection. There are also outbreaks in East Africa as well, in Kenya and Uganda in 2016. And there's obviously the role of migratory birds, but also the movement of people and goods across borders within continental Africa. And these pose challenges for disease containment and surveillance, particularly in rural areas. So what are some of the cross-sectoral lessons that can be learned? One in particular is the One Health approach. And this is particularly interesting and necessary within the continent of Africa because of the shared borders that most countries in Africa have. So you need a critical coordination of human, of animal, and also environmental health response, and also cross-border trade. There has to be effective risk mitigation, reduce containment. In particular, small have to be educated. They also have to be able to make their farming practices more resilient and less risky. There are also improvements that are necessary for early detection systems, because are slow to respond to the introduction of an avian influenza, then this exacerbates the spread, the chances of you getting it under control quickly. International collaboration, leveraging also international agencies, WHO, FAO, and OIE, and World Organization of Animal Health, across universities within the USA, Canada, the UK, and also communication and collaboration because there's limited uptake of biosecurity have to be brought down to the very layman terms to these poultry farmers, because I believe that they would want to increase their production. Want to reduce, it's just get to where they would want to be. And again, communication comes into play. Human health systems obviously need to be integrated with veterinary health systems. And this is a problem across the globe that needs further strengthening. And then animal health and One Health programs are often heavily underfunded. and then the emerging policies and the governance tools that are necessary to enable regional coordination and enforcement of regulations. So what we need is a holistic approach to avian influenza pandemic risk management in Africa. But these obviously face a lot of different challenges. So by strengthening One Health platforms, we integrate animal health, public health, and environmental surveillance together. Invest in laboratory and diagnostic networks. We know the Africa CDC is a major player on the continent of Africa in terms of regional coordination and to improve border outbreak management. There's also ECOWAS initiatives. And we need to empower, again, the smallholder farmers to promote affordable solutions that are customized to the content of their environment, and also leverage technology and innovations that can be implemented using AI, machine learning, and also digital tools for outbreak prediction. And so avian influenza pandemic risk presents unique opportunities in Africa. Veterinary and public health to collect together, strengthening community engagement, such as equipping poultry farmers with training necessary to prevent avian influenza, invest in vaccination and poultry, but also being able to have stockpiles of avian influenza or therapeutics, and then to foster cooperation among Africans. So taking action will enable resilience and risk in Africa for FP you have different. I think it offers a very, very adaptable approach to One Health, and it aids in cross-border collaboration. So I think this particular very, very good start to African nations will being able to track and trace. And this is not only from your wastewater treatment plants, this can also extend to aircraft wastewater management so that you know what's coming in via air travel into your country that could also put a risk. Because oftentimes we're looking at the risk only from the animals, but it's very likely that someone could be already infected and take a plane ride all the way to Africa with this disease as well, or vice versa from Africa. So in summary, avian influenza poses a real pandemic threat. The measure behind it, even if but also climate change is something that we all have to deal with. We all have to adapt, and there are demanding urgent solutions to So the call to act the national pandemic. Also, like our postgraduate programs in biosecurity and biorisk management, Center for Biosecurity Studies, we're going to be preparing persons to be able to protect their borders used from multidimensional threats, such as avian influenza. And these are some of the selective areas of focus: planetary health, climate action, disaster resilience, global One Health and security, sustainable global trade and diplomacy, cyber biosecurity, IT, and data sciences, because as the rise of artificial intelligence grows, we have to be able to leverage the power of artificial intelligence to be able to aid in the cost of the programs. You can have postgraduate certificate, postgraduate, full degree. Also, they full out masters of science. This is a talk at the Center and also the University of the West Indies at the KFL campus. I want to wish all of my brothers and I wish you all well. Contact us. Here is our website, and also here are our contact information and also our email addresses. So thanks very much once again to Dr. Bobo Doye and the entire GET consortium team for inviting us to be a part of this wonderful webinar. Thank you.
Thank you very much, Dr. Douglas, for doing very good justice to the subject matter. We really appreciate your presentation, and I've learned so much from it, and I'm sure our participants have learned so much from your presentation too. Hopefully you give us the permission to share the presentation with the participants.
Yes,
yeah, thank you for giving the participants. I've given the permission. So we're going to be sharing Dr. Kirk's presentation at the end of this webinar. So just a summary, Dr. Kirk talked about pandemic threats of avian influenza. He talked about the multiple hosts. The multiple hosts of avian influenza doesn't just affect birds, but bovine, swine, and even the ability to transmit to human makes it zoonotic, and that makes it a very interesting disease to discuss. It talked about the antigenic shifts, the mutation potential of avian influenza that can lead to human transmission. And he said we just have one strain away from having a strain that will effectively be moving from causing human to human transmission, and that will make it very dangerous and highly pathogenic. And talked about the African vulnerabilities, the factors that enhance vulnerability in Africa. Talked about the migratory birds. Talked about the socioeconomic factors on the continent, the high human population density and the need for protein that increase the contact between the humans and animals in search of protein and other necessities. Talked about biosecurity, lack of biosecurity in farms and other places on the continent that can increase the spread of the disease, and talked about climate change, the big elephant in the house that's affecting humans, animals, and the environment, and how we relate. We talked about the outbreaks in different parts of Africa, in Nigeria, in Egypt, and in Africa, and talked about some solutions to addressing outbreaks on the continent, the One Health approach, the need for increasing public awareness and education to enhance and other factors that can strengthen our preparation and prevent the spread of the disease on the continent. And I also talked about policy the need for us to align our policy in one direction and to integrate human and animal and environmental health, research and development, and funding of research on the continent. So that's a summary of what Dr. Kelkas of his presentation, and very detailed. Thank you very much, Dr. K, for that presentation. Wasting time, we'll go straight to our next speaker, but because before we'll go to the third and last speaker today, I think we have Dr. Clement back. I'm going to give Dr. Clement about 5 minutes to complete his presentation. If Dr. Clement is there, Dr. Clement, please, you have the floor for about 5 minutes.
If I can have the last part of the slides. If you can stream the last part of the slides.
Okay. Secretary, please, can you put on Dr. Clement's presentation as fast as possible?
Okay, the economic cost of highly pathogenic avian influenza. I was on the graph that shows how major zoonotic and economically devastating diseases across the world may be responsible for major economic losses. And with respect to highly pathogenic avian influenza specifically, the economic losses includes the fact that all the birds in a poultry farm may die. And that means an investment loss to the poultry farmer. And if the farm closes down, it means loss to even those that were employed in the farm. Next slide. Next slide. So in 2006, between 2006 and 2008, the pandemic wave in Nigeria, almost more than, specifically there were 312 outbreaks that were recorded. And this also followed a similar patterns for every wave of highly pathogenic avian influenza. A lot of outbreaks occurs across the country. So it then means a lot of cost is incurred in the process. And this is continuous. So then there may be a need for control measures. And so in this slide, I tried to offer some kind of general ideas on the control options. And this is centered around vaccination, biosecurity, and surveillance. As we know, there are vaccines that are being produced that can elicit a good immune response. And vaccines should be able to reduce surging of the feed virus, and vaccine that may be effective to be such that can be used as mass vaccination. As far as Africa is concerned, since about 2008, Egypt began to vaccinate. But unfortunately, the vaccines and vaccination protocol in Egypt has not been as effective as they would have anticipated. So we are still having outbreaks of different strains in Egypt, and that even vaccine kind of creates some kind of immune pressure. It's also resulting in a lot of emergence and evolution of the viruses. So as we speak today now, Egypt seems to have more novel strains of highly pathogenic avian influenza. We do not know the role of vaccine in this. And that is why countries, the rest of Africa, countries like Nigeria, South Africa, and all, have been a bit skeptical and slow with respect to adopting vaccination. However, because biosecurity also have not been optimum, and so the idea now is that all solutions can be brought to table, including options for vaccination. And vaccination will only be in addition to other control measures, that will also enhance biosecurity. And while all this is going on, there's also a need to always ensure that there's a continuous monitoring of the virus, epidemiological surveillance that will be able to detect outbreaks of the virus where they may be. And this will also now contribute into genomic surveillance that will be able to make detections and be able to tell us about strains that are emerging. And that will now contribute to ensuring that an early detection is made that can now even inform decisions that will be taken. Next slide. Next slide. So don't worry, in order to save space, I'll just go into the conclusion of this presentation. Now, I visited a poultry farm somewhere in Nigeria where I saw some of these biosecurity protocols, and it has always been instructive to be able to see how much of that can be adopted in many places. And number 3 says customers, visitors are not allowed into the poultry farm. So what this then means is that in order to be able to reduce the traffic of people, animals, and other products that may introduce highly pathogenic avian influenza into a farm, there will be restrictions of movement. By the time you have the slides, you'll now be able to see all the other biosecurity protocols. But in conclusion, what I'd like to also emphasize is that we are not out of the woods yet of highly pathogenic avian influenza. And in fact, the scenario is becoming more and more dangerous over time. As at 2024, I'm taking this quote from FAO. Interestingly, the work was done in Nigeria and Benin Republic. These viruses were detected in these countries. And what FAO has to say is that there was an introduction of a novel 2344B H5N1 reassortant. We have talked about mutation, we have talked about reassortment. So the virus keeps changing. And so this reassortant contains 6 genes clustering with H5N1 viruses from East and South Europe. That's to tell you that whatever happens in the rest of the world has implications for even Africa, for every country in Africa. And 2 genes of this virus originating from reassortment events with Eurasian low pathogenic avian influenza virus, telling you also that different strains, either highly pathogenic avian influenza or low pathogenic avian influenza viruses, has implications on the endemicity, on the burden of the disease, on the public health risk, on the potential pandemic, and even the economic loss. So these viruses are, the genotype were actually detected. And of course, they've only circulated in West Africa, Benin and Nigeria. And this may then be a sort of transmission to the rest of the globe. This was taken in 2024. So in conclusion, ladies and gentlemen, next slide, I would like to emphasize that we will have to be vigilant. We will have to be vigilant continuously to be able to contain highly pathogenic avian influenza and mitigate the risk of it being a pandemic virus. Thank you very much.
Thank you very much, Dr. Clement, for a very, very detailed presentation. We appreciate that, and I've learned so much from your presentation. And I'm sure our participants too have learned so much from your presentation. Hopefully, I hope you give us the permission to share with the participants.
Yes, you are permitted.
Thank you very much. So without wasting more time, we'll go to the last speaker of the day. Well, not the least, Dr. Taiwo Olasoji. I'm going to read Dr. Taiwo's bio for about 2 minutes and hand over the floor for him to give his presentation. Dr. Taiwo Olasoji is a distinguished veterinary epidemiologist and public of dedicated service health and disease management, currently serving as the Deputy Director and National Focal Point for Animal Disease Notification at the Federal Ministry of Livestock Development in Nigeria. Dr. Olasoji has consistently demonstrated In 2020, coordinated Nigeria's highly pathogenic avian influenza HAI risk assessment. Please, can you mute your system, please? So sorry, I continue with my presentation. Just highly pathogenic avian influenza risk assessment activity as a consultant to AU-IBA. This involves spearheading a comprehensive analysis of potential risk and facilitating a pivotal meeting of key stakeholders nationwide to deliberate on the findings and develop actionable strategies. Its leadership in this initiative significantly enhanced Nigeria's preparedness and response capabilities to avian influenza outbreaks. A staunch proponent of the One Health approach, Dr. Taiwo collaborations with international organizations such as AU-IFBA, FAO, and WAO have advanced regional capacity to manage transboundary animal diseases. His expertise extends to using epidemiological tools, including QGIS, EpiInfo, and Kobo Toolbox to support innovative disease prevention, surveillance, and containment efforts. Dr. Taiwo's extensive research experience his efforts to harmonize cross-sectoral strategies to mitigate zoonotic threats, ultimately enhancing health security in Nigeria and across Africa. Dr. Taiwo, thank you very much for joining us today. I hand over the floor to you, please.
Thank you, Dr. Babadoye. It's a pleasure. And I found it a privilege to share thoughts with colleagues. So straight away, may I move to the business of the day? A minute. Okay, so I've been given the assignment of walking us through ways in which we could strengthen prevention, surveillance, and containment strategies for avian influenza in Africa. Okay, so these are the outline. I mean, the topics I'm going to speak on, a bit of introduction. I'm happy that I'm having to speak after two colleagues have spoken. So I'll just build on what they already said about the disease. I will try to dilate a bit on current challenges in prevention, surveillance, and containment efforts in the country so that I'll be able to build on that to talk about system strengthening. And then I'll give you recommendations and conclude. So the first occurrence in Africa, actually the disease did not emanate from Africa, like often erroneously said. If you look at the map here, you can see that since 1996 to 2005, it's been on ground in the world, but none in the African continent. See this red button. None of the red buttons are here, but you see them here. So the red button denotes the outbreak between 1996 to 2005, and then thereafter in 2006, they did it first to the for Animal Health, and a few weeks later reported the same disease. There are 6 countries joined Burkina Faso, Cote d'Ivoire, other African countries. We still have quite a number of African countries that are without the disease, but Senegal also, reported its first outbreak in 2021. But it would be a good thing to note that some African countries have not reported it does not mean that the disease is not present there. It depends on the capability or the capacity to detect the disease and the willingness to report it. But it's evident and certain that the disease is still spreading, quite dynamic in Africa. Now, there's something that I would like to mention here. Egypt reported the disease almost the same time. But Nigeria was able to perform a magic. In 2008, we were able to have self-declaration of disease freedom, which OIE then, now, WHO recognized it and published it. Now, what did we do that made us to be able to wipe the disease from off the country within 2 years? Nigeria, up till now, anyway, the policy is still there. We have the policy of no vaccination, and we actually were very strict about it. And then compensation of affected farmers, the government was diligently carrying out that. It was so effective that whenever any farmer had the outbreak, they were even the ones to call the government, please come and check. I think I have avian influenza on my farm. Unlike now that they seem to be hiding it. And then active surveillance, just like you can see the map on the right-hand side. This was done during the first outbreak of the disease in 2008. You could see the targeted surveillance for second phase, first phase. Nigeria did that, and then it actually helped in being able to contain the disease. And then awareness creation. There was serious, aggressive awareness creation among all stakeholders, farmers, and even the common people that are not farmers. Though at that time there was misinformation that if you dare touch the meat, if you dare eat the meat, you will die. And several people steered clear of chicken meat, steered clear of even eggs. We had egg loss, and farmers really had a very hard time then. But the government swung into action and created awareness, passed correct information to people, and that was quite effective. Then enhanced veterinary workforce. At that time, the government took stock of the veterinary workforce and observed that we had gaps there, and then they employed quite a number of veterinary workforce to bridge the gap. And finally, quite a number of other things anyway, but just to mention these few. Finally, there was emphasis on best biosecurity practices, several trainings done on this, across the value chain, down to farmers, down to livestock marketers, down to several stakeholders along the value chain to ensure that the disease was contained. And true to it, effectively by 2008, Nigeria was able to wipe the disease from the country until and since then, it's been bouts of outbreak after one, to another. Now, I decided to put this here because we seem to focus attention on domestic birds, but the fact is wild birds are very key. Initially, it used to be just a low pathogenic form or strain, that was found in wild birds. But of recent, it's been very consistent that you have highly pathogenic strain also found in wild birds. You could see in 2001 to 2002, quite recent, the figures are very close, both in domestic birds. Domestic birds are the blue ones, and then the wild birds are the almost pink ones. So you have the figures, above 3,000. And then in 2002 to 2003, you could see that more outbreaks of HPI in wild birds were even reported than among the domestic birds. Likewise, in the present outbreak, you have more outbreaks in the wild birds reported compared to that of the domestic birds. So that underscores the importance of paying attention to wild birds, control or contain the disease in the continent. Just to say a bit or re-emphasize what the previous speakers already said about seasonality of the disease, you could see from the map, from the graph on the left-hand side, that the disease is, its prevalence or its outbreak is very, very low in September. It's low in September, then it begins to rise in October, and then, continues to rise in February. The same thing was actually, in Nigeria. To emphasize why we really need to pay attention to the disease in Africa. The implications are very serious. If you have it on a farm or in a country, living hard level, implications are grievous. We've observed that farmers that have it, you have depression, hypertension, such farmers experience hypertension, emotional imbalance, hospitalization, sleeplessness, stress, and eventually we've reported or recorded death as a result of this, apart from the direct death due to zoonotic implications of the disease, of this outbreak, and then job loss, contribution of the poultry sector to GDP, to the country's GDP, reduces immediately. So let me quickly say one or two things on current challenges in prevention, surveillance, and containment of the disease in Africa. Number one, the surveillance. We don't only rely on passive surveillance methods. Our surveillance methods are actually aquatic or analog. We use more of Excel spreadsheets, paper-based and paper-based forms and emails to conduct our passive surveillance system. When our other counterparts in other parts of the world have moved ahead. Then we have limited active surveillance. What we actually is survey. Surveillance is supposed to be continuous. To be every once to do it by annual, at least do it and that consistently. But here in Africa, we do sporadic, sample collection and diagnostics, and then we call it active surveillance. And after you have done it once, 5 years later, you might not do another one. Then gaps in integration of surveillance across human, animal, and environmental health sectors. I'll say a bit on that later on. So interpretability done, via mail. When I mention interpretability, I mean intersectoral collaborations between the human, the animal, and then the environmental health sectors. Presently, I know it's not only Nigeria, in other countries too, quite a number of African countries, you have electronic form of communication, as in data collection, quite at very low ebb. So we use mail, we use paper and file exchange. We call our colleagues in other sectors to pass information, and these results in time lag and then limited information passed. So prevention challenges now, minimal surveillance among wild boars, and then control of migratory wild boars. We conduct quite limited surveillance. Dr. Clem mentioned something like that. That was just a colleague trying to do it. But as a country, we really need to do this and that with consistency. Then there is the no vaccination policy. If you remember earlier, something like that, and it worked for the country actually, because apart from the fact that we declared no vaccination policy, we were compensating farmers. You don't vaccinate your boss. Once a farm reports the outbreak, just intimate the government, we collect the data of the farm, and eventually the farm or the farmer is compensated. But now, yes, the policy of compensation is still there, but it's not being, carried out now. It's there. It's not removed, but to actually compensate, it's been quite a while we did that. And that actually results in farmers, having outbreaks and refusing to tell the government because they know if they dare inform the government will call their boss. Quite a number of them, yes, we get to know, but I strongly believe that some farmers, that they're scared of their boss being called or being, destroyed completely. They refuse to inform government. So inadequate are poultry farmers and handlers, especially the backyard poultry farmers. We have commercial poultry farmers in Nigeria, but the local poultry farmers in Nigeria, the higher percent from backyard and we border farmers. Poor biosecurity practices farms and like, image on the right-hand side. Then containment challenges, finally, under the stuff. We have delayed outbreak detection and response. As we the issue of reporting, especially the present bout of outbreak of HPAI that we have in Nigeria started in 2021, and till this year we are still reporting the outbreak. When it first occurred in a particular farm, a scenario that actually occurred in the country. They were looking at it, they did not report, of course, they did not know what they had in their hands. And about a month later, that was when they collected sample, because they birds kept dying. Somebody will have come to the farm, a backyard farmer will have come to the farm, a worker in the farm that also had birds in his house will have carried the virus to his house. And after the detection, just 1 or 2 weeks thereafter, we started hearing, news of the outbreak in other states. So delayed outbreak detection and response can be very, very, devastating, contribute to challenges in containing the disease. Then over-reliance on vaccination. Egypt actually over-relied on vaccination. And that's what till now, they are still battling with it. And unfortunately, it's not only that is affecting their animals. Within the first 10 years of the outbreak in Egypt, almost 400 human beings have been infected, with the disease. So, and like the previous speaker also said, it's actually scaring others to go into vaccination because it's not been working for Egypt. So insufficient funding and resource allocation for containment measures. We can't overemphasize the importance of funding, but obviously there's not enough funding in Africa. For instance, if we have enough funding, then the issue of compensation would not be a challenge, but it's quite a challenge in the country. So let's learn strengthening prevention strategies. Very important. Farmers need to be trained. Apart from training professionals, yes, and training professionals on issues around the virus, farmers also that first, have a glimpse, that will first have a glimpse of the disease on their farm, that will first, detect or suspect the disease on their farm. They need to be trained on recognizing clinical signs of the HPAI. The country actually has a contingency plan, disease contingency plan for HPAI with clear-cut case definitions for the outbreak. So it's suggested that apart from having it in that document, it's good that we have something like handouts, leaflets that states clearly the clinical signs and case definition, the different case definitions of the HPAI, the suspected case definition, probably hello. So having such at the help in to detect the disease promptly, because when they notice this, when they notice it, immediately they inform. I think I've seen something, or I'm seeing something that relates to what's on this flyer, and then they relate it to the government, and prompt action is taken. So essentials and importance of strict farm biosecurity protocols, like was done in 2006 outbreak, period. Several stakeholders were trained. Aggressive training. We need to institute and maintain adequately manned international border. If we are able to eventually, get rid of the virus in the present outbreak, our borders are still porous, then you can be sure it's just a matter of time, just like we've been having since 2015 report another outbreak. So we need to station, qualified, equipped people at the border, and perhaps deploy rapid test kits, there, such that they can promptly, test. And some of these rapid test kits have high sensitivity. At least they are being able to detect something like that will raise, alert, and then prompt action will be taken. Then we need to expedite decision on the issue of vaccination policy. I'm aware, yes, and I know that the country is seriously considering changing the no vaccination policy. And not too long ago, this year, yes, a number of meetings have been held as to, changing the no vaccination policy, but it has to be scientifically based. So tree farms, breeder farms actually have been, picked from fairly across the geopolitical zones in the country. And then the experiment is being carried out so that we'll be able to scientifically determine and say, okay, yes, let's remove the no vaccination policy. But up to now, it's not been done, but from the outcome of that experiment, no vaccination policy might be changed. Now, even if we eventually adopt the vaccination policy, I will still, be of the mind, suggest, advise, recommend that compensation should still be maintained. Egypt did vaccination and then they still have it. But if we allow vaccination, fine. And if we don't compensate, vaccination can fail as a result of a number of factors, too much bombardment or vaccine failure or whatever, a number of things can lead to vaccination, not to be effective. But if compensation is there, that will still be the alert, So if you vaccinate and you still have outbreak and you alert the government and the government call your boss and you are compensated, I think we will still be able to effectively control and contain the outbreak in the African countries. So if vaccination policy is to be introduced or maintained, I try to outline or list some points here that I feel will be of help to the continent. One, we need to conduct as a nation, whether Nigeria, Egypt, Senegal, or any other country as it may be, the country in the continent, a nationwide active surveillance, should be conducted to identify circulating strains. Because if you develop vaccine, it has to be against these circulating strains in the country or in the continent. Well, this has to be country specific anyway. Otherwise, you will introduce another strain that is not present in the country to your country. And then match. Well, the best thing will have been that the country should produce, using the circulating strain. But if the country is not producing it and you want to import, make sure that you match the approved vaccine, with the circulating strain, or preferably produce the vaccine within the country, as I earlier said. So then active surveillance should be institutionalized to update the vaccine strains. Active surveillance, like I said, is done consistently, on a consistent basis so that you are able to monitor the strains that are circulating. So improving surveillance system, talking about strengthening the surveillance system. Number one, we need to integrate mobile-based reporting tools for ease of data collection and real-time, updates. Very key. I cannot overemphasize that. Then we need to strengthen active surveillance by conducting routine sample at high risk. I will talk about sentinel, surveillance just in the next slide. So we need to equip veterinary staff and laboratories with advanced diagnostic tools. We have there's this weakness or this gap in a number of African countries. Laboratories, very minimal, very scarce. Using Nigeria as an example, a very, wide country. A large country, but we have just one lab, supporting. Yes, fine, that's okay. But if we really want to tackle this disease, we have some labs like veterinary teaching hospitals. We have private labs. We have state-owned labs. We can specifically strengthen those labs, equip those labs with rapid test kits or simple, advanced diagnostic test tools that can detect HPAI, such that people don't have to send their sample or fear, the cost of sending samples at the suspect of the disease to a long distance. They have the laboratory close by. This will help us to be able to track the disease quickly. So the establishing surveillance sentinel surveillance networks will indeed help to institutionalize. Sentinel surveillance sites can be put or stationed in high-risk areas, such as live bird markets, white birds, areas, farms that are high risk, of picking up the disease. We station sentinel sites there, and they are there permanently, actually, with the mandate to collect sample, routinely at certain intervals of the year. And if they are there routinely and they are stationed there and officially stationed there, with certain people put there to man those places, then it's been institutionalized. And then the issue of active surveillance, or not being effective will have been taken care of. A suggestion here, state focal points can actually coordinate such sentinel sites. And I want to suggest that the countries, can have, just like we had in 2006, we have avian influenza, focal points in all the states in the country. Very effective a system, and that was why we're able to effectively control, the disease then. So we have such focal points, specifically, that's their mandate to tackle the outbreak of HPAI or the events of HPAI. The focal points can actually also be given the mandate to take care of the sentinel sites, and see to its coordination. And also a portion of annual budget can be devoted to sentinel sites. Partners anyway can intervene in this regard too. So advantages of establishing sentinel sites very quickly, you have early detection of outbreak because there are people there, apart from passive surveillance, waiting for people to bring suspicions. People are going out on a consistent basis to collect sample, so we are able to quickly detect, the outbreak of the disease or the presence of the virus, in those places. The monitoring of trends and pathogen evolution, data being gathered from the sentinel sites, and plotting, graphs with it will help us to know the trend, whether it is going up or going down or it's been removed. Then allows also for focused, resource allocation. Just like I said, the government knows that we have sent these sentinel sites there, so consistently year in, year out, and even the partners know that, okay, we have these sentinel sites that need help, so they are able to focus resources there to assist. Then there's intersectoral collaboration. We have normally in sentinel site, you have wildlife, and then you have public health officers there. So strengthening containment strategies, lastly. So one, I will suggest that we reenact the focal point for HPAI and train them like we did, like Nigeria did, and it worked. Other African countries can, go after that too. Then rapid response teams should be in place in each state or sub-region, and this should be multi-sectoral, one health approach, in focus. Then conduct simulation exercise for preparedness, just to be able to assess whether you are prepared, for the outbreak or not. And this does not really have to be national. It can be state or sub-region, conducted, and then develop and enforce policies to limit poultry movement inter and intra or subnational or national borders. This was done earlier. I keep referring to what happened in 2006. This was actually, put in place and enforced. But unfortunately, it's not being, enforced now. Very key, very important. If there's a particular outbreak in a particular farm, enforce strict movement, of poultry and poultry products from such, and then we'll be able to contain it to that farm. So secure funding for emergency containment measures, including calling and compensation for affected farmers. Very important. Then train on the importance of disease reporting, just like the present outbreak that we have in the country. I believe strongly if that case had been earlier reported and we had quickly swung into action, we will have continued on that farm, and perhaps it will not have spread to several states where we have it now. So my recommendation, I recommend that we invest, in e-data collection too. This, like I said earlier, we can't overemphasize it. I've even heard of a particular app that farmers can use, and apart from veterinarian, being able to collecting the data routinely, farmers can have, just like WhatsApp. Almost every farmer has WhatsApp now. When they observe something on their phone, something strange or strange sign, birds dying or sleeping, they can quickly pick it, put it on that app, and government sees it. The state government can assist, is symbiotic. The state government will quickly help in intervening, and then government also has data to know what is happening. So socioeconomic impact assessment versus compensation. It will be a good thing if an in-depth socioeconomic impact assessment is done, and then that is compared with how much we have to pay the farmers if they have outbreak, how much we will likely be spending in compensation compared to what we are losing. I want to believe strongly, don't let me preempt that, but by the time we find out that it's better to pay compensation and then the outrageous losses that we're reporting, and then the mental and the social impact on farmers and on the country, we will go for compensation. Lastly, sustainable funding mechanisms for the control of the disease. The last recommendation here that suggests that we pay attention to supporting research, on the local dynamics of the HPAI virus. Like I said earlier, if you look at the left-hand side, you have the low pathogenic avian influenza in white boss. That was the thing that you used to know, that white boss, they only have low pathogenic, virus in them. But now, because of research and then the mutation, you have not only low pathogenic AI in white boss, we also have HPAI, the highly pathogenic, in them too, so that they shed both the low pathogenic that can mutate into HPAI, and they shed HPAI directly, and this has really changed the dynamics of the disease transmission. I believe strongly that if we have more support on research, we will see that, more things have emerged about the disease, and our knowledge of such will help us in being able to know how to tackle the spread of the disease. In conclusion, the need for strengthening prevention, surveillance, and containment strategies for HPAI in Africa cannot be overemphasized. Governments, stakeholders, and international organizations should prioritize avian influenza management, strategies in Africa. Thank you.
Thank you very much, Dr. Taiwo, for that very practical and field-related presentation. Listening to your presentation, one will know clearly that you're a field man and you're talking from your very depth and wealth of experience. And thank you very much for the good job you're doing in Nigeria and Africa to make sure that we contain these zoonotic diseases and address public health issues on the continent. Your work is done all over the continent, and we sincerely appreciate your contribution. So as a summary, we hope, Dr. Taiwo, that we'll also be able to share your presentation with our participants after this webinar.
Let's go ahead, please.
Thank you very much, Dr. Taiwo. So as a summary, you spoke in depth, we give in-depth explanation about the spread of the disease in Africa, stating clearly, like other speakers, that we had our first outbreak in Nigeria in 2006, and stating that the disease did not start from Africa, but the first 2006 and 2008, Nigeria was able to contain the first outbreak effectively. And you gave some activities or some procedures that Nigeria followed then to be able to effectively contain the disease. And these include active surveillance, compensation of farmers, awareness creation of vet workers within the country, and very good biosecurity practice on the farm. And between 2006 and 2008, we were able to effectively curtail the outbreak because of those practices. And over the years, we've had outbreaks in different countries in Africa and Nigeria. It's talked about other things, some challenges that we'll face, the prevention challenges preventing or affecting prevention of outbreaks on the continent. We talked about the no vaccination policy in Nigeria to if possible review the policy, inadequate awareness of poultry farmers and those that handle and poor bus practices on farm and in both markets in the country. We talked about challenges affecting containment, delayed outbreak, over-reliance on vaccination, insufficient funding, especially when it comes to animal diseases. And we talked about the need for us to strengthen the system. We talked about strengthening containment strategies. We talked about improved surveillance systems. We talked about nationwide active surveillance for us to expedite decision on vaccination policy, and to train farmers to be able to identify, understand, and communicate disease outbreaks on their farm. And finally, you gave some recommendations, which include socioeconomic inputs, assessments, as early and as fast as possible. We talked about data collection, especially e-data collection. And we talked about funding, which is very important for us to be able to effectively address this challenge. So thank you very much, Dr. Taiwo, for the presentation. And we're getting close to the end of the webinar today. Two things before we go. Number one, if we have one or two participants today that wants to say one or two things from one, we can just raise your hand, go to the Zoom platform, raise your hand, and we'll give you 1 or 2 minutes to just contribute to this webinar. Also, as we close this webinar, let me use this opportunity to say thank you to our speakers today, and not just our speakers today, and those that have been with us since January. GET has been able to organize this webinar every month from January, and this is the 11th edition of the webinar, the only month at our 10th anniversary of the annual GET conference on OneNet and biosecurity. We sincerely appreciate the contribution of the speakers and our participants since January to today. The reason why we've been doing this every month, and we hope that this platform has become a platform to create awareness, to discuss emerging issues in the area of biosecurity, and to give information about challenges and issues that do with net and on the continent. For us to continue to do this, we'll look forward to your support and collaboration next year. And two things that we're planning to do this year, we're going to be sharing a feedback form with all our participants and speakers immediately after this webinar. The form is just for you to review our activities for the year, to let us know what we're doing right, and to suggest areas that we think you can improve on in the year 2025. Like you said, one of the aim of GET is to create awareness on emerging issues in real biosecurity and OneNet on the continent. And this platform has become one of the biggest platforms we're using in recent years. So we'd like to hear your feedback and let us know what you think we can do to improve what we are doing currently and where you think we should improve on. So thank you very much to our participants. I think we have one hand on. And secretary, I give the person raising his hand the opportunity to unmute and speak for about 2 minutes. I can see there's Sheikh Ford. I hope I'm pronouncing the name well. And I can see, oh, okay. I have
Hello.
2 people. Okay, Mr. Sheikh, can you go on, please?
Yeah, thank you so much. Thank you for this very interesting conference call. And I really appreciated the contribution of all the 3 presenters. And I think that if we could do the same for the other countries in West Africa who face outbreak of AI, I think that the epidemiology of AI in Africa could be highlighted. Clearly, because Nigeria and Egypt cannot be excluded in understanding what is happening here, and I appreciate really what is being done in Nigeria. So I think that, as they highlighted, there is 3 I can say pillars very important where need to address. The first is the surveillance system, very weak due to human resources, so financial resources, and also lab capacity. For many countries. So Nigeria has a good capacity with VOM to have the possibility to detect and also to support other countries. The second important thing is biosecurity along the value chain. I think this is something that we really investigated. We need to pay more attention on this area, given there is not enough regulation, and if regulation exists, it's not really enforced. And I think that this is something we need clearly address to really tackle the disease. The last one will be the opportunity of vaccination. This also needs a lot of consultation, reflection, and also to see how we can take advantage of the possibility of having the vaccination properly implemented to at least reduce the massive death linked to the emergency of big diseases. So building capacity of stakeholders is very important, like veterinarian, and yeah. So I think that this is it was at all. Thank you so much. It was a very interesting meeting, and I wish that for the next so conference call you'll be inviting us, because this is the first time I'm joining. Thank you so much.
Thank you very much, Mr. Sheikh, for the contribution. And I agree with you that challenges all over Africa or in most African countries are similar. Surveillance system, capacity building, lab, both human and lab capacity, biosecurity threats and challenges, vaccination and the need for us to build capacity, both human capacity and capacity to effectively conduct surveillance and equip our lab to effectively diagnose these diseases as fast as early and accurate as possible. Much share, we focus on few countries in Africa, but the aim of this platform is to know what is happening in all countries, most countries in Africa in the area of biosecurity and One Health, and hopefully by to see what we can do to expand our reach in other African countries. So thank you very much. We're coming close to the end of this webinar series and the last webinar series for the year. But before we go, can we take final word from our presenters today, starting from Dr. Kirk, Dr. Taiwo, and Dr. Clement. Final words, please.
Well, I wanted to congratulate GET on their continued efforts in spreading the word about biosecurity and providing a platform where we can discuss these very critical issues. And it is my hope that the strengthening of systems across Africa will be a strength. And just to note that the University of West Indies, the KFL campus, and all the other campuses are definitely strong partners for us, for you in Africa to work with to help you achieve your objectives as well. So thank you very much.
Dr. Taiwo, please.
Okay. I was thinking of speaking last as usual. But that's okay. Okay, so honestly speaking, it's been a privilege to express my thoughts here during this webinar. But I also want to suggest that quite a number of recommendations have been given by the various speakers. It would be a good thing to find a way. Avian influenza is the control actually starts from the top. Of course, the low level are very key in its control, but when you talk of control, containment, detection, it actually starts from the top. So it would be a good thing to actually relay some of these recommendations, find a way of relaying, these recommendations to them. So thank you.
Thank you, Dr. Taiwo. Dr. Clement.
So I really appreciate GET for this opportunity and the opportunity also that they've given to other scientists across the continent. Continuous education cannot be overemphasized. And so what you're doing is one of sort. And what it also does is it empowers professionals. I know a lot of professionals that listen to these programs, and I know one or two things will have been taken as an added information. And as much as we keep talking and keep letting each and everyone know about the problem at hand, then as we appreciate the problem, that's when we begin to find solutions. And I think this is going to be one of the achievements of this organization. And I also enjoy the fact that, with avian influenza, it's a kind of a disease that we can actually use as a template for the one health approach that we've been preaching, because it is a disease that is both cross-cutting, intersectorial, and multidisciplinary. And we are able to work effectively with what we preach to bring it to bear. I mean, there will be solutions to a lot of problems apart from even avian influenza, but other emerging infectious disease. and pandemic can be prevented. We just have to start now.
Thank you very much, Dr. Clement. And we'll come to the end of the GET webinar series for the year 2024. Before we go, I want to state that one of our plan or one of the things we've been doing is to have an annual compendium of a policy document based on our webinar series from January to December. So we are going to put a policy document like a compendium together based on the different topics we've discussed in the year, and we're going to circulate it as wide as possible so that hopefully it gets to policymakers, it gets to various stakeholders, and it can become a document that can be useful in decision making, not just about within the continent of Africa. So thank you very much. I sincerely appreciate your contribution today, Dr. Douglas, Dr. Clement, and Dr. Taiwo, and to all our participants that have been with us. From statistics, we've had over 100 participants from Omna today. You are the reason why we organize this thing every month. Thank you for staying with us throughout this year. And we hope to continue to do this and even improve on what we're doing in the year 2025. We look forward to your support, collaboration, and assistance in any way you think you can. And we look forward to continuous collaboration with your university too, and your institute, Dr. Kirk. You do a fantastic job, and we look forward to bigger collaborations in the year 2025. I wish everybody a wonderful holiday. I've started my holiday already. I've been in North America for some days, and that is why I'm dressing differently today. It's early morning and cold in this part of the world. So thank you very much. Have a fantastic holiday period, and we'll meet in 2025 by God's grace. Thank you very much, and bye-bye from GETS.
Thank you very much.
Thank you.